Today on Community Conversations, Plymouth Health and Human Services Commissioner Micaela Bratti talks to Child and Family Services CEO Wendy Botelho.
Wendy, it is so awesome to have you here today and to talk about all the incredible things that Child and Family Services does. We really at HHS have been looking at multiple components of health, and honestly, mental health is probably one of the biggest components that we're looking at. I'm sure in any community, but definitely in the Plymouth community. I'm really excited about what your agency offers and was excited that you were going to take the time to talk with us today, or talk with me a little bit and our community about what you do. So, mental health, here we go, right? I know since COVID, particularly, it's been difficult for people to find providers, to know where to turn for services, or even to know what mental health is these days. So talk to me. What is going on in the mental health world, and specifically, what are you here to offer Plymouth?
Yeah, absolutely. And again, thank you for having us. We're always excited to be able to talk about mental health and how it impacts all of the communities that we serve.
Yeah.
We are here in Plymouth. We have a CBHC, which is a Community Behavioral Health Center. We're on 61 Industrial Park Road here in Plymouth, and we're in partnership with High Point Treatment Center.
People didn't even know that.
I know.
People didn't know you were here. I didn't know you were here. I'm so excited. Go ahead.
So we're here, right?
Yeah.
And what's a Community Behavioral Health Center? Well, it's part of the Behavioral Health Roadmap that Massachusetts launched about 2 years ago. And Child and Family Services, we actually have 3 Community Behavioral Health Centers.
Wow.
But here in Plymouth, what we have is same-day access that folks can walk in, receive services through High Point through High Point Treatment Center, and they can get their mental health crisis services through Child and Family Services. Same location, right there on 61 Industrial Park Road. We've actually been in the Plymouth area for 15 years, which is shocking to a lot of people who don't realize
here in Plymouth, just
right?
catching up.
And what we do, our part of the service is crisis. So 24/7, right? So that's the other really important part. 24/7, we're available for anyone's behavioral health, mental health crisis needs. We can come out to your house. We can meet you at your location, if that's your school or your work or your parents' house. We can meet with your children. We can meet with yourself, with your parents, any age, any insurance type. We can either invite you into our office or we can meet you at your location.
Wow. So walk me through this. I'm someone that's feeling like things just aren't good. And I'm worried, or I'm not in great space. I can call the number that we're going to provide to our community, and someone will answer.
That's right.
And kind of assess how I'm doing or what my needs might be.
Yeah, exactly. So I'll say the number now, and we'll say it again, right? Because it's really important. It's 508-996-3154. And when you call that number, you will get a live person who answers the phone. And it's through our call center. And they'll be able to triage and assess what's going on, right? So you're able to say, I'm just really not in a good space. I've been feeling depressed, right? Not feeling myself. And I really don't know what I should do. And we'll be able to talk through some scenarios, right? Does that mean that we need to make sure that you get seen by an outpatient clinician, right? Does it mean that you need a crisis eval and we need to go out to your home? Right then, we'll be there within 60 minutes is our requirement, that we're there within 60 minutes. Or that you come to our location, right? We talk about what the different options are and how we're able to service you and what works for you, what makes sense for your life and what's going on and how you want to be able to be assessed.
So this incredible service is available in the Plymouth community.
Yep.
That phone number for anybody that needs to reach out, and they will be helped through that process.
That's
and
right.
determine best needs for that person or family or child, as you said, anyone. That's incredible.
That's right.
I'm super excited that you're here. Talk to me, though. I know you mentioned that it's through High Point, and I know you and I had an honest conversation about sometimes people think of High Point, which is an incredible agency within itself, but when they think of High Point, they think that maybe these services are only for people with addiction issues or opioid struggles.
Right.
Talk to us about that.
Yeah, so they're not, right? Plain
Okay,
and simple,
good.
they're not.
I
They're
love
for
it, yeah.
everybody,
Okay.
right? And so the services are provided through Child and Family Services, and we've partnered with High Point. And so our crisis services are a big part of what Child and Family Services does, and the individual counseling and what they call core services is through High Point, right? But we're partnering together, we're working together. And so what's really great about that is we get more substance use experience by partnering with High Point. They get more experience through behavioral health, through partnering with us and with children. And so we work together to be able to provide what the community here in Plymouth needs.
That's amazing. And you're right, that you're just helping each other and teaching each other, but you don't have to have necessarily an opioid issue to access these services, as you said.
Absolutely not.
But if you do,
you can get services
you've
too.
got 2 for 1. Right, exactly. So that's amazing. And I know many of our residents actually know about the service you provide already in Plymouth, but probably don't know that you're the Oz behind the curtain, that you're actually the agency. Many of our residents know about our incredible Plymouth Police Department triage team, if you will. So can you tell us a little bit about that, and for those that don't know, but how you're connected to that?
Yeah, absolutely. So 2 years ago, we met with the Plymouth Police Department and we established a co-response program. We have some established in Fall River, New Bedford as well. And we reached out to Plymouth and we were able to start with clinicians. And we were up to 16 hours a day where we have a clinician who rides along with the police department, and they're able to respond to mental health calls. They actually respond to all calls, but they're specifically engaged to try to respond to those mental health calls. It allows for the clinician to be able to de-escalate with individuals. It allows for individuals to be able to have that touch point and be able to work through some of those mental health needs that they may have that don't necessarily require police intervention, but people don't always know that they can contact us for that.
Yeah, I think it's really incredible that I know our police chief, Chief Quinn, is a huge fan of
It's been a great
child
support.
and family and a great partnership. But really, for a community to understand, such as ours, I think it's incredible that, just like you talked about your partnership with High Point, you look at, I'm calling it criminal justice, but you look at the police world, right? And they're looking at things from their perspective, as they should. They have to keep the community safe. But for our police department and others that you mentioned to understand that people sometimes need additional or different types of help, but their actions may be looking, a little unstable. I love that they understand that that is an incredible benefit for our community, and I know it's been an extremely successful program so far.
It has been, and we're able to allow so many more individuals to understand the services, and so that way next time maybe they don't need to call the police or they don't need to go to the hospital, right? Because I think it's important to note that we're able to do crisis evaluations without going to the hospital, right? Hospitals mean long wait times, crowded emergency rooms, and so you're able to get those services through us. We'll triage and be able to have those conversations and be able to have whatever the next level of care is for you, right? And if that means a hospital setting, then we can work through that, but we can provide a lot of intervention before that. Because even though I mentioned that we're crisis services, you don't have to be in a crisis.
Okay, that's
right?
important.
It's really important, right? So do we work with individuals who are in crisis? Yes, we do, right? But are we also just working with somebody who's experiencing extreme anxiety or depression or substance use or, right? So we really actually want to work with you before you're in crisis so we can provide intervention and assistance to you so you don't need those higher levels of care.
I love it. Tell us about your next adventure in Plymouth,
Sure.
your new initiative. I know you made a presentation.
I know. We have
the
a
select
very
board. They were very excited.
Yep.
Talk
We're
to
pretty
us.
excited too. So our next adventure is a mobile crisis van, right? We've really recognized that sometimes people just don't come to us, right?
Sure.
So we're going to get out there and go to them, right? So we will have a van here in Plymouth, in addition to some of our other locations, that is out in the community, right? It'll be a van that individuals can access. So certainly, if we get called out to somewhere, we can use the van. We We don't always have to. We'll drive in our personal cars, but if that's appropriate, we can do that. But really, it's just to be out there in the community so that way people can see us, recognize us, know what we're doing, and come to the van to be able to get services. We'll be able to work with people. It's a mobile office. So people can come right into our van. We can do the assessment, and we can come up with our next steps from there.
It's not like you're riding around in a van with a bullhorn saying,
No.
hey, anyone needing some services, come
on in.
It's
No.
literally an office.
It's an office on wheels.
With chairs, with like literally
Yep.
a private office. And, you know, it brings up a good point, and I hope it goes without saying for our residents and community. This is confidential.
Oh, yeah.
We understand, and you understand that people just sometimes need some help. And that's here, ready and waiting through Child and Family and honoring where people are at.
Yes.
It's tough today. It's a
It
little
is.
tough out there.
Yeah,
So
it is.
last, how would you define mental health? What should people call for? What might they be experiencing that they might want to reach out to you for some additional help?
Sure. I mean, I think that anybody who is experiencing thoughts of wanting to die or hurt themselves or feeling suicidal should absolutely reach out, number one, right? We want to be able to do suicide prevention first and foremost. But we also want to work with people before they start feeling that way. Do you not feel the same at work? Are you not getting the same type of enjoyment? Are you not sleeping well? Are your relationships doing poorly? Are you finding yourself anxious all the time? Are you just not feeling like yourself and you can't sort through it all? Those are the times we want you to reach out. For your loved ones, for your children, is their behavior different? Are they not responding in the same way? Are you having a hard time getting them to talk through what their problems are? Are they having difficulties in school, right? Sure. Those are times that you can reach out. We want to be able to be preventative. We want to be able to work with you before you feel like you're in crisis.
I love that you have this here in Plymouth.
We do.
And I can't thank Child and Family enough supporting this community, being part of this community, and really embracing what people need and services that they have at their fingertips. Wendy, it's amazing. Thank you so much for being here and part of our amazing community. Thank you.
Great. Thank you.
Thank you for watching. If you enjoyed what you saw and want to stay up to date with our latest content, don't forget to hit that subscribe button. It's the best way to make sure you never miss out on the amazing discussions, insights, and entertainment we bring your way. And hey, if you find value in today's video, be sure to give a thumbs up by smashing that like button. We'll see you next time.